How are you doing? I'm just going to make sure I have my sound up. I'm using my iPad, which was MIA for a while, and I thought this would be a good thing to use today. I'm just grabbing the correct link. It came to my attention that recently it's been said, and I want to make sure, because I know there's going to be questions, there's already been questions about this, that I address this head on and be able to have something that we can then tag you in as you are asking your questions about, is it safe to ingest Spike Lavender for respiratory issues? So for those of you who are in my essential oil safety training course, you know we went over this a couple of weeks ago and we talked at length about ingesting, what is safe and what isn't. And those of you who aren't in the course can actually get a taste for that as well in my podcast using eossafely.com/004. You have probably already heard it by now. It's been out for a couple of years, but there is a time and a place for ingesting. So I just want to make sure everybody realizes that although you will see a lot from me saying don't ingest, because most of the things that you are finding out there for recommendations for ingesting are not safe, are not recommended. But there are a couple of situations where ingesting can be beneficial, where the benefits actually outweigh the risks. And one of those situations is lavender for anxiety. So if you are taking lavender in a capsule with a carrier and you are consuming that as a way to cope with anxiety where other methods may not have worked for you, that has actually been proven clinically to be helpful for some people. Now, that is not the very first thing that I would ever recommend for anxiety. I would recommend inhaling lavender or inhaling other essential oils, or maybe, other sort of methods before jumping to ingesting lavender essential oil for anxiety. Another thing that can be safe for some people with IBS is ingesting peppermint essential oil. Now, both methods would only be a drop or two with a carrier in a capsule. Now, for peppermint for IBS, you want to make sure that that capsule is enteric coated. And what that does is it gives that capsule a chance to make it through the stomach and into the intestines where IBS is a thing, and to be able to treat IBS in that way. So there recently was posted some research that was found to be useful for respiratory issues by ingesting Spike Lavender. So I know there'll be questions. There's already been questions about this. Is it safe to ingest Spike Lavender for respiratory issues? So we are going to quickly talk about, I have 0 things prepared, but I'm just going to talk about what are the pros and the cons, what are the benefits and the risk with ingesting. Let's just start there. So what are the risks with ingesting? You have possible irritation around the mouth, in the esophagus, in the stomach, and then your liver also has to deal with anything you are consuming. So if you are adding essential oils to your water and essential oils don't mix, we learned this in grade school, you can get that burning and redness and irritation in the mouth as well as in the esophagus. And we've talked about this before. We've had people say they've gone to their doctor and they have confirmed that with the ingesting of essential oils via water, that they have had ulcers, they've had GI issues, and all of that attributed to ingesting when adding the essential oils directly to the water itself. Now, when you are ingesting in general, those are the sort of risks that you have. You have the topical irritation or the irritation inside of your body from having that irritation with your mucous membranes. And then you have your liver that has to process everything, whether you're consuming it in water or whether you consume it in a capsule. So is it safe? It's always about risk versus benefit. Now, if we look at Spike Lavender specifically, because we always want to make sure that the essential oil that we are consuming does not have any contraindications for ourselves. So in the instance of peppermint and IBS, If you have GERD or if you have G6PD deficiency, that is something that is contraindicated with using peppermint essential oil. So it's not always about the method of ingesting where capsules are safer. It's also, let's take a look at the safety issues of the essential oil itself. Some essential oils are potentially carcinogenic. Some essential oils have drug interactions. So let's take a look at lavender, Spike Lavender Essential Oil from my book Essential Oil Safety Files, and let's take a peek at that. So we are learning that Spike Lavender has a topical max of 19% because it can cause irritation, redness, sensitization, but primarily because it's neurotoxic. So consuming a neurotoxic essential oil, in my opinion, is not worth the risk of the potential benefits for respiratory issues. It's also potentially convulsant. Which means if you have epilepsy, then it's something that you want to avoid even inhaling. And then of course, do not use around your pets. So Spike Lavender being neurotoxic, which is why there's a 19% topical max, because it does have some constituents in there that are neurotoxic. And so if you are to use it, you need to dilute it very well. So there's that. So as far as research showing that Spike Lavender can be beneficial for respiratory issues, okay, first of all, that's great. But are there other things that we can do that are going to be as effective to help respiratory issues than consuming Spike Lavender, which I'm reading by the end of both 7 days and 10 days, all measured parameters showed significant improvement in the treatment group compared to the placebo group, with the exception of the sputum production. So listen, 7 to 10 days. There's a lot you can do in 7 to 10 days. A lot of respiratory issues are already going to go away in 7 to 10 days. So let's look at ingesting Spike Lavender, which is going to be a burden on the liver, which is a neurotoxic essential oil, which is potentially convulsant. And let's think about other things we can do for respiratory health, such as a steam inhalation. So if you have respiratory issues, whether it's coughing, whether it's, trouble breathing, whether it's just being all clogged up in the lungs, in the sinuses, a steam inhalation is going to kick that in the butt. Kick it in the butt. And you can use something like tea tree essential oil, or you can use fir needle essential oil, or for over age 10, you could even use eucalyptus essential oil. I actually prefer fir over eucalyptus for respiratory issues. There are other things you can do that are super effective than consuming essential oils. That's just not going to be as effective. And it's not as risky either. Always weighing risk versus benefit. So a steam inhalation is something you can do, and it's very easy to do. You can either get a facial steamer that has a nose option on it, so that it just goes around your nose instead of on your whole face. That's a quick and dirty, easy, plug it in, heats up in a couple of minutes. You don't have to mess with boiling water, although it does get hot and it does steam, and it's contained right in your nose, and you can simply breathe it in. That's one option. Or you can do the old-fashioned steam inhalation method, where you are boiling water, you are pouring it in a bowl, you have a towel over your head, you are dropping 1 or 2 drops of essential oil in that steam, and that steamy bowl of hot water, and you are breathing that in for several minutes until things are just falling out of your face and just getting unclogged and all of that stuff. That is the best way to deal with respiratory issues. You can also use a personal inhaler. You can also use a diffuser, both of which are not as effective than a steam inhalation. But if you are hell-bent on ingesting, if you want to use your essential oils internally, then I would also suggest a suppository. Now, I've talked about this before, that when we are talking about using essential oils internally, it does not always mean via the mouth. And the reason why suppositories are surprisingly, to some, effective for respiratory issues is because there's a huge blood supply in our colon. So when we are using a suppository, and this can mean coconut oil with a couple of essential oil drops added. It could mean cocoa butter, which melts when it's on the skin. That could be another way of doing it. And that, surprisingly, is actually very effective for respiratory issues because of the blood supply, which our lungs are full of blood as well, and that systemically it can get in our system and be effective. So if you want to use essential oils internally for respiratory issues, which I do not recommend, there are other safer, more effective ways to do it, then I would suggest using a suppository instead of consuming your essential oils in a capsule. It's going to be way more effective. And then again, back to Spike Lavender being neurotoxic, also being potentially convulsant, is not the essential oil that I would choose to use. So just wanted to come up on here and let you guys know and answer this question as you may see it in your feeds that this is a thing, and just give you my opinion on it. But that being said, if you want to put, X amount of drops into, of Spike Lavender, which is neurotoxic and potentially convulsant, in your capsule and consume it, that is completely your choice. As always, you're completely free to take this information and either take it to heart or completely disregard it, and that is completely fine. Stacy, can I post about the G6PD and the peppermint? Same story with vitamin C IV. Just that if you have G6PD deficiency, that you should avoid peppermint essential oil. So that was just an example of choose your essential oils wisely to make sure that there are no safety issues for you specifically before you use them, because there are a lot of different considerations. There are which way are you using the essential oil, there are which essential oil are you using, how you are using it, frequency, dosage, all of that stuff is something that you need to consider before using the essential oil. And yes, this is going to be recorded and left here in the group. We will be tagging people in it because this is a question that I know will definitely continue to come up. So if you have any questions, go ahead and leave them below and I'll be sure to answer those for you. And I guess that's all I have to say about that. Again, risk versus benefit. Is Spike Lavender the best option for respiratory issues? And should you ingest Spike Lavender for respiratory issues? I say no. I say there are other methods that are more effective for respiratory issues than consuming via a capsule. Not to mention that there are going to be other essential oils safer than neurotoxic Spike Lavender to use for respiratory issues. Okay, signing off. I will talk to you guys later.